There we go. Recording in progress. So welcome, everybody. Thank you for joining us. So first of all, just a bit of logistics. So the session is recorded, so you will have access to the video afterwards. Leanne is going to be sending you an email after the conference with a link to the video and also a link to the evaluation, which she will also probably put in the chat if you want to fill it out now, but it can wait after the conference so you can focus on the conference itself. So it's about an hour and you'll have a question period. So please keep your microphones on mute. And if at the end we'll have a question period, you can put your question in the chat or simply raise your hand in the end and say that you want to ask a question. Leanne is my colleague. She'll be monitoring the question period. Okay, so I will start by giving you the biography of Mr. Dr. Georges L'Espérance. So trained as a neurosurgeon, 1984, Université de Laval, Dr. Georges L'Espérance completed a master's degree in health services administration at the Faculty of Medicine, Université de Montréal in 1998. Until 2015, Dr. L'Espérance was assistant clinical professor of the Department of Health Administration, Faculty of Medicine, Université de Montréal. Initially a member of the Société des médecins experts du Québec, which in 2008 became the Société des experts en évaluation médico-légale du Québec, he served as its elected president from 1998 to 2016. In 1999, he co-founded with Dr. François Sistier the training course in forensic medicine under the auspices of the Faculties of Medicine, Université de Montréal. His clinical experience and personal reflections have naturally led him to question the purpose of medicine and, in particular, ethical issues such as over-medication, ethical issues, in particular over-medicalization and end-of-life issues. Since November 2014, he has been president of the Association québécoise pour le droit de mourir dans la dignité, AQDMD, now devotes most of his time to it and is deeply involved in the provision of this ultimate care that is medical aid in dying. So without further ado, Mr. L'Espérance, you can take the floor and enjoy the conference, everybody.
Thank you very much. Hi, everybody. I hope you have a nice day, even with the storm. Hope it's not too bad in your place. Well, excuse me also for my English, which is not as fluent as my French, but I think you'll understand anyway. So I'm a neurosurgeon, and as a neurosurgeon, I work mostly in my life in traumatology and general neurosurgery. So that's why all this bring to me to what are we doing with those patients that have cerebral catastrophic state, which are vegetative or another kind of very profound comatose patient. So that was one of my always question. And I'm president of the association since 2014. I have no conflict of interest, and I'm a MAID provider now. Doctors and nurses in Quebec that can evaluate patients for MAID and can also give MAID. We call us provider, as it's in the rest of Canada, in fact. The association, one short word on the association, has been founded in 2007 by Madame Hélène Bolduc, a nurse who is still very active and very alive. We have 7 members of the Conseil d'administration. We are there's absolutely no fees for conferences. We're all volunteer on that association. All the conference I give are all free of fees, but we always ask the organism that ask for conference to give something to the association. We are funded only by donation and contribution, and since 2020, we have a grant from Quebec government. So we've been able to hire a general manager, André Wyszynski, which is very, very active. And this also permits us to have Maître Jean-François Leroux, a legal advisor. Maître Leroux was one of the 2 lawyers in the case of Madame Gladu and Mr. Truchon in 2019 that brought the change in the law to take off the criteria of to be in end of life to have medical aid in dying. The association works to ensure that each citizen can legally choose and receive end-of-life care that includes medical assistance in dying in accordance with their own concept and of dignity. Since this year and for the years to come, we will also inform patients on all the care at the end of life, so palliative care and palliative sedation and all that. So we will open a bit our goals. We are active. The activist component of the association is to work with parliamentarians, federal, provincial government, public mobilization. Educational component, we give information to members and general population and support to information for families. I want to tell you that all this conference will be available for you by Miss Dussault. So she will be able to send you right after the conference. You will have and more. There will be also more slides on the conference that will be sent to you, so you don't have to take notes. We have regional sections. In 2022, it begins with the Quebec City Collective, then east of Quebec, Laurentide in 2024. And since this year, we have the creation of the Collectif de l'Outaouais, and the porte-parole, the person who takes care of it, is Nathalie Jones. And I give Nathalie a few seconds to present herself. So Nathalie, go ahead.
Hello. I don't know what my picture is still by the side, but I'm sorry I can't rectify that. I'm Nathalie Jones. Like Dr. L'Espérance was saying, there are a few collectives in Quebec. The education component is the very foundation of this collective of the AQDMD. Their mandate is to inform and raise awareness of Quebecers about end-of-life care, including medical assistance in dying. So since January, we're starting a new collective in Outaouais, so the people in Outaouais will have more information about this. To do this, I need some volunteer who can work with me to do that. I invite you to get involved now by becoming a volunteer member of the collective. If you are interested, you can write to me at collective.outaouais@aqdmd.org. Or you can call me at 343-204-3761. So we're gonna do a lot of work to disseminate information in the Outaouais, so they have good information about their rights, end of life rights. Thank you, Dr. L'Espérance. Up to you.
My pleasure. Also, I want to say that perhaps you know that there's a big organization in Canada, which is called Dying with Dignity Canada. We are not a branch of Dying with Dignity, but we always exchange with them. We know each other, of course. But the AQDMD is independent of Dying with Dignity Canada. So, this morning, excuse me, we'll have 4 chapters. We'll talk of advanced medical directives, current criteria for obtaining medical assistance in dying, what we call contemporary medical assistance in dying, a few words on the future, and we'll also finish with the advance request, which is now in force in Quebec since November. So, whoops. Advanced Medical Directive. What is that? Advanced Medical Directives, each citizen should complete their AMD. Even if you don't have any disease, each citizen should complete that. It's only in Quebec, in the province of Quebec. It's not anywhere in the rest of Canada. It's only in Quebec. It's in the Quebec bill from the beginning on the assistance in dying. It's specific and unique to each citizen. So I see, for example, the name here of Miss Carmel Simard. If Miss Simard asks the RAMQ, Régie d'assurance maladie du Québec, to get her paper for advanced medical directives, that will be to the name of Carmel Simard. That's it. Why is it important? Because it avoids therapeutic hardness. If you came to the hospital, comatose, or if you don't have any, you cannot talk or you cannot exchange with the doctors and the nurses, this advanced medical directives is the same thing that if you were talking to the doctor and you say, for example, I don't want to be kept on the respirator for those weeks. I don't want to be kept in a vegetative state, etc. So it is the same thing as if you were talking to the doctor or the nurses. You can have more information on advanced medical directives on our site, aqdmd.org. You can also go directly to the site of the Quebec government, and you will have a lot of information on advanced medical directives. I repeat, it's only in Quebec, in the province of Quebec. It doesn't exist in the rest of Canada. You can also call directly the RAMQ to get your advanced medical directive, and it's very easy to fill. I'll go right now for here. But you cannot ask made by advanced medical directives. It's very important to understand that you cannot ask made by advanced medical directives. There's 3 clinical situations if you complete your form. You will have a description of end of life situation. For example, you are in a coma, or you have severe and irreversible impairment of your cognitive functions, or other severe situation of irreversible impairment. So those 3 clinical situations, they are described in the form. You just read that and you'll see what happens to that. And they will ask you, if you are in that state of coma, for example, would you like cardiac resuscitation or renal dialysis? If you agree, well, if you agree to anything, you don't have to do your advanced medical directives, because they will do for you. Of course, the doctors will do it. But if you don't want to be kept on a respirator, for example, you just say, I refuse, and this will have it will be for the doctors and the nurses as you were talking yourself. So it's a very nice thing to do. For example, a lot of people ask me, well, if I do a very bad cerebral stroke, and I don't want to be on a respirator, may I ask for MAID? No, you cannot ask for MAID, but you should do your medical directive when you are in a good physical form. So any other wishes that a person wishes to express must be made in a document other than the advanced medical directives. To obtain your document, and everybody of you should do it, all your person that you live with, everybody should do their advanced medical directives. And you can, as I said, go directly to the site of RAMQ, or directly to the site of the government of Quebec, or go on our site and you will have the information. There is a small booklet like this. You can have it also on the net. This is not to be confused with advance request that is now available in the province of Quebec since November 2024. Advance request is for cognitive neurodegenerative diseases, example, Alzheimer. It has been adopted on June 7, 2023 in Quebec, and it's in force since October 13th in 2024. We will come back to this in a few minutes. It's still not recognized at the federal level. So advance request is only in the province of Quebec, and advanced medical directives are also only in the province of Quebec. What is a protection mandate? Perhaps somebody of you have always understand, who have been aware of that. The protection mandate, what we called before a mandate in case of incapacity. You may write this, or you may have a protection mandate for your old mother or your old father, and it means that you're gonna take care of them, and you will answer to health problems for them if they're not apt anymore. But you cannot ask made by a protection mandate. So let's go with current criteria for obtaining contemporary medical assistant in dying. We now say contemporary in the contrast of advanced directives that we were talking a little bit later. So what are the current criteria? Why MAID? Because respect of principle of personal autonomy of each person and respect of principle of dignity and freedom of choice. The actual data in the last year, 2023 to 2024, 7.3% of deaths in Quebec have been done by MAID. It's a little bit more than the rest of Canada, which is somewhere around 4%, but there's some explanations for that. But it's not it doesn't mean neither that everybody will ask for MAID. Absolutely not. It means that more than 90% of people will come to their death in their natural death, if we can say that. And the vast majority of population in Quebec and also in Canada is in favor of MAID. Let's see what is the curve of MAID in Quebec. At the beginning in 2015, of course, there was none. Then there was a slow progression on that. In 2021, the criteria of being to be in the end of life has been turned off, you can say that. So there was a big, not a big, but there was a slight increase in death by EMM. And then we see that this year there's a slowing of that curve. So it means that probably in the next years we'll come to something around 10% of death by MAID, probably something like that, but there will be a slowing of that slope. It's always the same thing. Some data for on MAID, 75% of people are 70 years old and over when they ask MAID. Cancer is the main problem for 60% of those people. And they ask MAID in 86% when they have less than 1 year of prognosis, which is absolutely not the same thing that you can hear sometimes from people that are opposed to MAID. They will say, well, everybody who will get a diagnosis of something, they will shut the door of the doctor and they will say, I want to have MAID. Absolutely not. 86% of people who are requiring MAID have a prognosis of 1 year or less, which is very important. It means that people want to live. They want to live, they want to have treatment, but at a certain point, when they know that the disease will not be cured, well, they know that they feel that they have enough of treatments, well, it means that they are ready to have MAID. Where is it done? 55% in hospital, it's in Quebec. Also in the province of at home in almost 30%, in long-term institution in 9%, in palliative care residents in 6% of people. Now, in Quebec, the palliative care residents have the obligation to accept MAID if a patient asks for it. Does it mean that the doctors and the nurses and all the personnel must or have to participate to MAID? No, absolutely not, because there's a personal objection, a conscientious objection. But it means that the residents cannot stop MAID request because they are Catholic or anything like that. They must offer it if the patient wants it. I want to clarify right away, excuse me, that there's absolutely no opposition between end-of-life palliative care, continuous palliative sedation, comfort case, medical assistant in dying. All these modalities are available to the patient according to what she or he desires and his own values. No one is obliged to take one modality over the other. It's in the respect of autonomy, dignity, and freedom of choice. This must be very clear. So what are the actual criteria in 2024 to 25, excuse me, to get what we call contemporary medical assistant in dying? It means that you will ask medical aid in dying for the next month or perhaps in the year to come and 2 years in 2 years to come. It's what we call contemporary medical aid dying. So you must be eligible for health services. It's the same thing in all the other provinces. It's mean that a person from Ontario with her health insurance card of Ontario cannot come in Quebec and vice versa. You must be 18 years old and over and be apt to decide. This is the first criteria that we're looking at when we meet a person who asks me, is that person is apt to decide for himself or herself. Also, I want to tell you that the law in Quebec was since June 2014, and the criminal code has been changed in 2016, and there is a change also in the criminal code in 2021. But now, just remember that the two laws are compatible for the contemporary medical aid in dying. So you must be apt to decide for yourself. You must have a grievous and irremediable medical condition. Does it mean that you must have a cancer? It means, for example, that if you have a chronic renal insufficiency, you don't want to, you may have dialysis at home or the hospital 3 times a week. That's okay, that's perfect. But if after, for example, 10 years, you don't want to have any more dialysis. If you stop dialysis, you will die. So it's mean that it's a grievous and irremediable medical condition. Another example that we see more and more for very old people, what we call dégénérescence maculaire, or the person is losing her vision progressively. It's a grievous and irremediable medical condition. All those conditions, when they are grievous and when they are irremediable, it means that they cannot be cured by any kind of treatment, that you can have access to MAID. Also, the other thing for treatment, which is very important, is that in the Charter of Rights, nobody is obliged to have any kind of treatment. So if you don't want to have, for example, chemotherapy for a cancer, it's your absolute right not to get chemotherapy, and you may ask for MAID if you want it. It's your absolute right not to have any kind of treatments. This is very important to understand. You must be in a irreversible decline. So it means that at the beginning, if you have a diagnosis, for example, of a multiple sclerosis, well, at the beginning you have the diagnosis, but you don't have any more impact on your life, so you're not in a very irreversible decline. But with the years, if you are, for example, in a rolling chair and all that, well, you are progressively in a irreversible decline. Irreversible decline is following what you think is deteriorating you. It's not the doctors or anybody else to decide what is irreversible, what is an irreversible decline for you. It's your own perception. Same thing for the physical and psychological existential suffering. It's your own perception. It's not the perception of the doctors or anybody else. It's intolerable suffering. It's you that is suffering. It's not the doctor. Because I heard that sometimes when people call me or at the association, and they said, well, doctors, I asked my doctor and he told me that I'm not yet at that stage of suffering. It's not the doctor to decide if you're suffering or not. It's you that you feel that you have your suffering, and it's you to decide if you have enough of suffering or irreversible decline. This is very important to understand. This is your own life. Whoops. There's one distinction now in Canada and Quebec. At the beginning, Quebec made its own law, and the medical aid in dying was only made by a physician. In Canada, when they made the law in force in June 2016, when they changed the criminal code, they said that medical aid in dying may be done by a physician or a nurse practitioner. It's still the same in Canada, but in Quebec, only since December 2023, that now a nurse practitioner can give evaluate patient and give MAID. So it's the same thing in Canada and in Quebec now. What is not the same thing in Canada, they have assisted suicide, which means it's a medical aid dying by pills that you take yourself. We don't have this in Quebec, and nobody wants to have this. Nobody talks of that. In Canada, in the last year that we have numbers, in 2023, there was 7 people in the whole Canada who asked for assisted suicide. It's really not something that is asked for. Just precision here. In Switzerland, probably every of you heard of Switzerland. They have assisted suicide since after the Second World War. But it's assisted suicide. It's absolutely not medical aid in dying. And the person must be able to open the fluid line to take the medication. Also, in 11 states in the United States, like for example Oregon, it's assisted suicide. It's absolutely not medical aid in dying. The doctor will give the person, the pills, and the person will take the pills when she's ready for that. And also in the states of Oregon and other states in the United States, they must be with a prognosis of 6 months or less. As doctors, we are very bad to say if a person has 6 months or less to live. We can say that the person probably has 24 hours or less to live, but when we're talking of months, it's almost impossible to talk of that with precision. So, how to request contemporary medical aid in dying? The patient signs his request with a doctor, nurse, social worker, any kind of health professional, known or not known to the patient. It's absolutely not mandatory that you ask that to your own doctor. Any professional may sign the request for medical aid dying. The professional has an ethical and legal obligation to forward that request to your organization in your place. In Outaouais, it will be the CIUS de l'Outaouais. And then a doctor or a specialist nurse will go and see you and evaluate the applicant. So even if your doctor have conscientious objection of medical aid dying, he or she has the obligation to send the request. And then a doctor or a nurse practitioner will evaluate you. The doctor or the nurse who is not comfortable with medical aid in dying doesn't have to evaluate you and doesn't have to give MAID, but he has the obligation to send the request. So the form is very easy. You put the name of the patient here. As a patient, you sign right over here, and then the professional health professional, will sign here, and one witness will sign here. That's it. That's the request that will be made. And if you're eligible, as the first doctor or nurse will evaluate you, if you find eligible because you have all criteria we saw before, the doctor or the nurse will put you in 2 tracks, what we'll call track 1 or track 2. Track 1 is if your death is reasonably foreseeable natural death. For example, you have a cancer, metastatic cancer. It's for sure that the disease will bring you to your death. So if you are in that track, there is no legal calendar time to ask for MAID. For example, you ask it, I received the request today. I will see you tomorrow at the hospital or at your home. And a second doctor or nurse can see you also in the same day, perhaps before, and said, yes, I know Miss Smith, and Miss Smith has a metastatic cancer. So the second opinion is right. So you can have medical aid in dying 2 days later if you want. You can have it 3 months later, 6 months later, but you may have it right now if you want it. If you are in the second track, track 2, or natural death is not reasonably foreseeable, for example, Parkinson's disease, there's a waiting period of 90 days. But after 90 days, you may have MAID at the 91 day or 6 months later 1 year later, 3 years later, as long as you're apt to decide for it. The only limit is that you must be apt to receive it. And there's absolutely no obligation to do again all the evolution and all that. No, you have been evaluated by a doctor or a nurse. We will keep your file. Well, the nurse or doctor will keep your file, and then that's it. You do your life. And 1 year and a half later, you will call your doctor and say, well, doctor, now I'm ready. So we'll see you. You're still apt? Perfect. We'll go with contemporary medical and dying. So, for example, you have two categories of patients for contemporary medical aid in dying. It's since March 2021. The first track, patients reasonably foreseeable natural death. Cancer, advanced heart or lung failure, for example. There is no reflection period, and you may have made right now. And the other criteria remain mandatory. If you are in the second track, for example, multiple sclerosis, severe rheumatoid arthritis, Parkinson, there's a 90-day of delay, and then you may have your MAID whenever you want. For example, I just had one patient yesterday. I saw him in December. The second opinion has been done by a doctor 2 months before. So his 90 days period was ending at the when was it? And at the end of January. So I was able to give MAID yesterday, beginning of February, because we were at 96 days or something then. How to request MAID? After the first doctor or first nurse has evaluated you, the first evaluator, the first provider, a second evaluator must see the patient or the file. And then after that, everything is on the own of the patient. He chooses his or her date, where you want to have it, at the hospital or at home or at his cottage or anywhere else. And then the patient also decide which person he wants to have with him. All that, it's the only choice of the patient. Reminder that conscientious objection exists for evaluation and administration of MAID, but ethics and law require a transfer of the request despite of the conscientious objection of the doctor or the nurse. They have the obligation to fill the request with you and send it. Every citizen has the right to ask to be assessed for medical assistance in dying, but it's a right to obtain MAID only if the applicant meets the medical and legal criteria, of course. So, a few words on the future. Major minors, which are the young youth between 12 and 18 years old. Now they cannot ask for MAID because they don't have 18 years old. But a lot of people want to go further with that, to have criteria to be put in place to give access to MAID to minors aged 12 to 18. Why? Because it's very unusual. For example, leukemias now, they are very well treated, but some cancer like sarcomas are not always treated. Well, I mean, they're treated, but they're not, they cannot be cured. And a youth at 17 years old may ask for MAID because he has metastasis in his brain, his lungs, and all that. So for now, that young people cannot ask for MAID even if you would like to have it. Those major minors are very more mature than a lot of people. So it's not. We're working to have this that those young people, may have access to MAID. Fortunately, it's very rare. Those diseases are very rare, fortunately. So even if it's pretty rare for those patients, it's very bad, and they should have access to MAID if they want it. The second part is mental health diseases. It was supposed to be effective in March 2024. Liberal government postponed it to 2027. And then with elections and all that, we don't know what will happen for now, but I don't see a very very near future for those people. It's very sad because those people with mental health diseases, of course, after 20 years, 30 years of evolution, they should have access to medical aid in dying because it's a real disease and it's kind of discriminatory rule that those people who have a mental health diseases cannot have access to meds because of their diagnosis. Never in 2015 the Supreme Court make a list of diseases that would give access to meds. Never the Supreme Court said that mental health disease patients should not have access to meds. So it's discriminatory and it's not constitutional. So we'll see in the future. So let's go for the last part, anticipated request. A person who receives a diagnosis of a degenerative neurocognitive pathology, which is the long term. We'll talk of Alzheimer's because it's the more frequent one. Those persons could, through an advance request, obtain MAID when they deem it relevant for them, according to their values, and even if they lose their attitude. The decision will have to be initiated by an agent. So this is the fourth and last part of that small talk this morning. Advance request. Whoops, excuse me. I just let the French one over there. So ensure that the person who receives a diagnosis of cognitive neurodegenerative pathology can obtain MAID through an advance request. People with a neurocognitive disease have not always been incapable of consenting to care. When you have a diagnosis of Alzheimer's in those days, perhaps you have 8, 10, 12 years to live in front of you. And you are totally apt to decide for yourself, but you know that you have what we call a neurodegenerative cognitive disease, which is not always the Alzheimer, but it's easy to talk of Alzheimer. But that person now is able to take decision of care. That person has capacity to give free and informed consent to certain care in advance. For example, even if you have an Alzheimer diagnosis, but you're still living at your home and everything is okay, and you have to be operated for something, we will discuss with you whether you have that condition. We have to operate you. Here are the advantages and the uncertainties, etc., and you can decide for yourself. But for advance request, you must obtain a diagnosis of the disease before they become unfit. So it means that, whoops, sorry about that. It means that you must make your advance request before you become unfit. Just a word on this. If you have now a diagnosis of Alzheimer and you're still apt, you may have MAID, no problem, because you have all the criteria. You have a grievous disease, you are apt to decide, etc. So you may have medical aid in dying. But if you still have pleasure in life, going out with your family, going to restaurant, well, you will lose months or even a couple of years of a pretty interesting life. So that's why we have now in Quebec, and only in Quebec, advance request. That law has been adopted in June 2003, and it's in force since last October in 2024. We have problems in the future because you may now do your advance request, but it's not yet accepted in the criminal code, even with numerous asking from the government, and from us also. The federal government didn't want to change the criminal code for now. But the advance request, what are the criteria? You must have a diagnosis. We already talked of that. Advance request must be done when the person is competent, it is apt to decide for itself. It must be done by the person herself or himself for herself. You cannot do that for another person. And the advance request allows you to receive MAID in the future under certain conditions. So for now, we're talking in February. Now, many people did their advance request now. I did 3 in the last month, but we will not give MAID before 1 year, 2 years, 3 years, 4 years when that person will become inapte. But for now, you can do your advance request, and you can have a lot of information on the government of Quebec site, and there's also an English part in it. There's different type of dementias. We're always talking of Alzheimer, but there's many more: vascular dementia, Lewy body dementia, pig disease, etc. We're talking of the medical term is dementia. The long term is neurocognitive degenerative disease. What is the procedure? The person must have a diagnosis, must be 18 years old or more, and must be able to consent to query. So it is exactly as for the contemporary MAID. The request must be made freely without external pressure, and it must also be made in an informed manner. It means that we must have a meeting with the patient, say, "Hi, lady, or miss, or mister, you have an Alzheimer's disease. You have many more years in front of you to come with an interesting life. But what I will tell you what will happen with your disease. That's what will happen the next year with your disease. So you must be informed very, very strictly on your disease, and the person must make it themselves and for themselves. The first step, what we call the first step, it's oops, sorry, didn't translate that. It's the request to make an advance request. You must talk with a health or social service professional to see what is that disease I have, what is the future, what can I expect of the evolution of that disease, and then the person will describe in detail in his request the manifestations or symptoms related to the request, and which will constitute the expression of his consent to receive medical aid in dying when that person has become unable to consent to care and that the conditions provided for by the law are met. I will give you an example. We make categories of those dementia. It was at the beginning for Alzheimer, but now it's for all those diseases. We're talking of mild stage, moderate, or severe. Severe, those people are in institution. They don't know who they are, where they are, etc. Moderate is the stage where probably you will not be able to live in your apartment, and you must be in a special house or a special request, as they said in Quebec, a Maison des Aînés, for example, or CHSLD. Mild disease is at the beginning of the situation. It's the stage here where everybody can make his advance request if you have a diagnosis and if you are in those stages. The disease will lead to incapacity and will affect the various spheres of brain function at different rates and not always according to the same evolutionary pattern. It's very important to understand that because not all people are following the same pattern of those diseases. One person will have more problems, or for example, on long-term memory, and other people will have more problems with language, etc., etc. So it's not really not linear in evolution. It's different for each people. But the damage to the person's sphere of life are always the same. In the order of appearance and severity may vary from one type. For example, you will have problems with common activities like banking, shopping, laundry, etc. You will have problems with communication, language, reading, writing, with mobility, coordination. You may need a walker, you may have falls, you may have difficulty with eating because you don't remember how to put food in your mouth. You may have You will have cognitive problem with cognitive faculties. At the beginning, short-term memory, and on the long-term memory. You may have cognitive faculties, for example, for hygiene. You don't remember that you have to take a shower. You don't remember that you have to brush your teeth. You don't remember that you have to go to the toilet. And at the end, behavioral and neuropsychiatric changes like wandering, irritability, confusion, aggressiveness. So this is the evolution of all those diseases, but it varies for one patient to another. For example, when you will write your advance request, I will say to the patient, well, if you are at the stage that you need to be fed, a caregiver or family member has to put food in your mouth, would you still want to go on with your life, or you would like to have made at that time? You decide. And if you decide that is the limit, you don't want to go further, well, we will do what we call a medical translation in the other part of the form, and we will write the person cannot feed himself. Another example, when you will have memory problems that worsen and the person may begin to no longer recognize your loved one. Is it for you a limit that you don't want to go further than that? And if you say yes, well, we'll write no longer recognize loved ones frequently or constantly. So as you can see, the person who asks for advance request will give the doctor, and we will write this, that what is the limit of the patient, that the patient doesn't want to go further, and we will translate it. That's the term I use, translate it in medical terms. So in 2 years, 3 years, 4 years, even if not me, it will be another doctor, another nurse. They will know, well, that person is now at that stage, she cannot feed himself or herself. So we know that it's at the stage that that person didn't want to go further. Then the other part of the procedure, still when you are apt, you have to name one or two trusted person, if these are called trusted third parties. In French, it's a tiers de confiance. Their role is not to give maid, absolutely not. Their role is not to say, oh, it's time to give maid to my father or my mother. No, their role is to ensure, to tell the medical team that your father or mother or the person is now at the stage where she didn't want to go further, if all the conditions provided by law are met. So now, still in the first part, still in the actual, you're making your advance request now. You have to sign the application in the presence of the physician or specialist nurse with 2 witnesses and one or two trusted third party if you have any. You can also do your advance request without any trust party and without witnesses in a notary, but it will cost you something, and that's it. But you can do it on a notary. Whoops, excuse me, on a notary. Oh, where am I? Here. Now, this is the form that we, as doctor or nurse, we have to fill. We put the name of the patient here, the diagnosis, date of diagnosis. And now here we will write on the computer all the limits that the person gave to me. For example, when I will not be able to feed myself, I will write that, And then in the third, on the second page, on the third part, I will write the clinical medical translation. If I can say that, I will say, that person cannot feed herself or himself alone. So that's the only thing we're doing in that form. Can you withdraw or modify your advance request for medical assistance in dying? Yes, but a person who is able to consent to care may withdraw or modify their request at any time by being accompanied by a doctor or a specialized nurse. By using the form, we will change the other form and we will modify the request. But we have to do the total things, the total, how do you say, excuse me, I'm losing my words. We have to do all the stuff to begin and do another request. but we can write the same thing except that we change what the person wants to change. Now, you did your advance request, for example, in February 2024. You're okay, you still have fun in your life with family, but the disease is progressing. And let's see, for example, in 2027, you're not apt anymore, and you are not now at the conditions where you didn't want to go further. So if, for example, I was your son, I was your third party, a confidence party, and I say I will raise my hand and tell the medical team, oh, medical team, my mother is now at the stage where she didn't want to go further, and she's now inapt. So we are what we call in part 2. When will you be able to receive medical aid in dying? You must have made a request, for sure, of course, before. You must have the clinical manifestations related to your illness present or on a recurrent basis. This will be the doctor or the nurse that will evaluate you and see if we have all those clinical manifestations. And then it's very important to see what the article of the law wrote. You must have a medical situation that gives rise to two competent professional, doctor or specialized, to believe on the basis of the information available, which means what was written on your request form to them and according to the clinical judgment that the professional exercise. So it's very important here, for example, clinical judgment. For example, if I'm in face of you and you are demented, I don't know if you have a psychological or existential suffering, but I know that you wrote it 3 years ago. And in my clinical judgment, I know that you had written that and you didn't want to go further than. So of course you're demented, so I cannot ask you if you have a psychological suffering, but you wrote it 3 years ago. So that's why it's according to the clinical judgment. And a lot of us will do in 2, 3 years, 4 years on that basis. On the site of the Government of Quebec and also on our site on AQDMD.org, you can find two booklets very, very well done for a guide for the person who is asking for advance request and also a technical guide. I look for that in English, but I think they're still not there in English. Well, at least I didn't find them. So you may have them in French. Of course, they will be translated, I think, in the next weeks or months. You may have English information here. When you will receive by Ms. Dussault the conference, you will just have a copy that, or you can go and Google advanced request medical aid in dying, and you will have all this in English also. So, in summary, for all that, medical aid in dying, contemporary medical aid dying, etc., to ask for contemporary made in dying, you must be 18 years old or over. You must be able to decide for yourself. You must have a serious and incurable illness. You must be in an advanced decline. You must have suffering or psychological or existential suffering. When that you feel yourself, not anybody else feel your suffering. It's you that feel your suffering. Your advanced medical directives, that must be done by everyone, but you cannot ask made by advanced medical directives. All dementias are admissible as long as you have the capacity to understand it. And advanced medical requests are legal only in Quebec. This does not exist in the rest of Canada since October. Mental disorder only if you have only a mental disorder, for example, schizophrenia, it's prohibited until we don't know when. If I place on the other side, you cannot ask made for someone other than yourself. You cannot ask made in your advanced medical directive, neither in a protection mandate. You cannot ask maid in advance, just in case. Oh, my mother has Alzheimer's, so perhaps I'm at risk to have Alzheimer. I would like to make advance request. No, no, no. You cannot make that. You cannot make that in advance. You can make a request of maid in your notary's office, but it doesn't give you anything because it will cost you some dollars. And also, it's not the notary that will evaluate you. It's a doctor or a nurse. You can also put your request made in your will, but it comes after your death, so it doesn't give you anything neither. What are your options? I'm able to make decisions for myself now, and I have no disease. You must, not you can, you must do your advanced medical directive. For example, you have no disease, but perhaps you will have a cerebral stroke that will leave you in a coma. So if you did your advanced medical directive, you're protected, but you cannot sign for contemporary made, neither for advanced request. You have a physical disease, you must do your advanced medical directives. You have a serious and incurable disease, you may do your advanced medical directive, and you may ask for contemporary made. You have a dementia, Alzheimer, you can do this. You may ask for contemporary made, and you also actually in Quebec only make your advanced made request. You have a physical disease and a mental disease. For example, you have a cancer and you have a schizophrenia, but you're apt. You may do your advanced medical directives, and you may have contemporary made, and you may also, here. You have a dementia and a physical disease. You have, for example, an Alzheimer, and you have also a cancer. You may do this, you may ask for contemporary made, and you may also have your advanced made request if you're still apt. And then you have a mental disease alone, for example, bipolar situation or schizophrenia. The only thing you can do is your advanced medical directives. So I think this last point, few last point. May I give my organ if medically dying? Yes, except that you cannot give your heart, and you cannot give your organs if you have a cancer. And it also must be done in hospital. You cannot do this at home, and it's supported by Transplant Quebec. Does my children may have all my life insurance? Absolutely. This is in the law since the beginning. There's absolutely no restriction on that. All your children and everybody else may have all your insurance rights if you are deceased, because on the certificate, it's death certificate. It's not written made. It's written the disease that brought you to us made, because made is a treatment. So, for example, a family send me that letter. In French, vous avez fait ce moment. I translated, you made this painful moment a beautiful souvenir. In this storm, you brought us peace, calm, and gentleness. Medical assistance in dying is legitimate, legal, moral, ethical. It's a compassionate care, and it's absolutely nothing away from the vast majority, more than 90% of patients who wish to go through with their passage, notwithstanding the physical or psychological sufferings. You have a lot of information on our site, AQDMD.org. Go there. There's also an English section. Well, it's most of a big part of it is translated. You will have a lot of information on our site. And I live this on this sunset image of the place where I live, usually in the Bas-Saint-Laurent. So now we go with question. Go ahead. Don't worry about that. There's no stupid question. Sometimes the answer may be stupid, but it's not your fault.
Yeah.
Yes, so do we turn first to the chat? Is there a question in the chat, Liane?
Yes, I saw him, and I think it disappeared
Oh,
now.
yeah, me too. I think it
Yeah,
disappeared.
it's because it has been answered.
I think so. I
It
think
was about
it
the
was regarding
certificate.
insurance.
Yeah,
So
about the insurance.
yes,
I
and
think so.
Douglas the House covered it. Okay.
I just want to add that the presentation, I'm not going to send the presentation by email, but it's going to be posted in a website, okay, in a few days. The video plus the presentation. In a few days, everything will be on this. It will be on our website.
So
Okay?
you'll be sending another email.
I
with
will
the
send an
links.
email
Yeah.
about the questionnaire, and I will put, you know, the site, the website where they have to do to click to see the video and presentation.
Okay, so now we're turning to the floor. So you may raise your hand, or there's also a function that you can click on. It's raise hand. It's one of the options you have. So are there any questions,
Go ahead, don't hesitate.
comments, whatever? Okay, Mr.
Smith.
Smith?
Yeah, we, first of all, thanks ever so much for the presentation. Yes, a
Hello,
cuckoo
hello,
clock.
cuckoo.
Yeah.
It's
your line.
11.
Okay,
Tiffany
it's
from
done. It's done. First of all, thanks for your presentation and thanks for all the work you're doing in support of MAID. A question about the advanced medical directives. We did ours 2 or 3 years ago. Is there anything new in the form or the requirements that says we should go back and redo it? Our ideas haven't changed, so.
No, absolutely not. It will be. I don't think there will be anything that will change in the next 10 years because it's what you want now. So the only thing that would make you change your advanced medical directive would be if you said, for example, you said I refuse dialysis, and then you say, well, perhaps I will ask for dialysis. So it will be, but it's you if you want to change something. But there's nothing in the law for that. But you know what? It's there since it's in the law since many years, but before that, when we didn't have those law, at the hospital, we're doing the same thing with patients, with family. If you have that kind of disease, you may come to the hospital in a very bad state. If this happens, would you like us to keep you on a respirator, for example? So we are used to do that since many years. But now with advanced medical directives, the thing which is very important is that it is mandatory to the health system to listen to what you said on your medical directive. So even if you, for example, you are in the center of Montreal and you're going to a more religious institution and you have a doctor who is very a Catholic and he still want to keep you on a respirator for 1 year, well, even if he thinks that, he must, it's mandatory, it's in the law that he must listen to your advanced medical directive. So this is why it's very important. And also, for all those people who doesn't have, for example, families or children, or they have only 1 or 2 children, when they come to the hospital, if nobody knows what that people want, that person want, we don't know what to do. So we will treat that person and then we'll take a medical decision. But for example, if a lady come to the hospital comatose, her daughter knows her pretty well, and she said, "Well, I know that my mother didn't want to go to be kept on a respirator for months." Okay, perfect. But now that lady also has a son who didn't see her mother since 5 years. And then that guy who comes from Alberta or from United States or from Texas said, I want to keep my mother on the respirator because I know that in US they will do miracles and all, before Trump, they will do miracles and all that, and they will give her life again. No. So now the son and the sister, they will fight. Well, my mother didn't want that. Well, I know that she wanted that, etc., etc. So if you did your advanced medical directives, it stopped all those discussions because it's you that decide what you want for you, even if you're now in a coma.
Yeah.
Okay.
That's why it's very important to that. Everybody must do it since 18 years old.
Thank you.
Good. Okay. Anybody else would like to comment, ask a question? I think we have one in, yes, we have a question in the chat. When a person arrives in an ER, would staff check for an advance directive before treatment?
Good question. In fact, no. Normally, if a person comes to an ER, comatose or after an accident, for example, everybody will jump at that person, and they will put a lot of tubes in a lot of holes. And if they miss any holes, well, they do more holes to put more tubes. That's what we're doing. That's what we're formed to. But after that, somebody will say, well, oh, it's really that cerebral hemorrhage, for example, that brain hemorrhage is very, very bad. Perhaps we'll look if that person made her advanced medical directive, and then they will look at it. But the first reflex will be to jump on the person, except if that person is really is coming blue in the emergency room. There's almost nothing to do. But normally, we will jump on the person and we'll look at the advance request after, because we have to do a diagnosis before.
Mm-hmm.
But that's a good question.
Yeah. Anybody else before we leave? John Smith.
Yeah,
Yes.
one more question about advanced requests for MAID. One of my questions had been how to figure out what kind of criteria to put down. But it sounds like the process is that I'd go in with an idea of what I want and what I don't want, and the physician would help translate that into something on the form. Is that right?
Absolutely.
Yeah.
But you're right. It's if you never saw a person with Alzheimer's disease or any kind of those diseases, well, you don't know exactly. So you just know that you don't want to be in your bed as a baby, and before that you don't know. So that's why a couple of us have made a kind of guide, which is not official now, but we're working on that with Collège des Médecins also is working on that, and in the next weeks or month, we will have a kind of guide to help doctors and nurses to go through, because it's absolutely right. For us, we know what's going on with the disease, but for the vast majority of people, they just heard of this, but they didn't see anybody in their family, or most of them didn't see anybody, so they don't know exactly. For example, a lot of people don't know that if a person is going further in his disease, it arrives at a stage where that person don't know how to eat. A lot of people don't think of that, but that's our role to say, well, in the evolution of your disease, there will be a stage, perhaps for you, pretty soon, perhaps later, that you will not be able to eat. You have something in front of you, but you don't know what to do with that. So that's what we have to explain to people. So that's what I'm doing with those people I saw up to now. Said, I give you a very, very easy example. The first step. If you lose I always add to my if you lose your driving
Permit.
license, permit or license? Same
Driving,
thing.
Same thing.
driver license, the same. Yeah.
So if you lose your driving license, is it a matter for you to ask for MAID or not? Oh, no. Anyway, I don't like to drive, so okay, perhaps. So we go to the other one. If you cannot do your own laundry, I'm talking to ladies. If you can do your own laundry, is it a reason to ask MAID? Well, no. Perhaps a man will say yes. But you say, no, it's not a problem. Okay, so we go through this. And then after that, if you cannot talk anymore, if you can read anymore, if you cannot read anymore, is it a reason for you to ask me? Ooh, a good part of my life, my pleasure is to read. I will think to that. So we're going through so it takes time, but it's the only way we have to do.
Will that guide be available on the organization's website for us to look at?
I have to make some arrangement with colleagues to just valid. I use it, but it's
Mhm.
it's a
It's not
beta.
official.
It's
Yeah.
a beta guide for now. So,
Okay,
but
okay,
in the next month, next weeks or month, we want to have something more official, even if it's not a government and all that. It's clinical. It's really a clinical guide.
And
Okay.
you would have it on your AQDMD.
Yeah, sure. And I try to have it to send it to the Collège des Médecins and see what they will do with that. And
that kind of guide available to us as patients would be extremely useful.
yeah, but that's what we want to do. Absolutely, you're right. Absolutely right.
Thank you.
In fact, up to now, I had 3 patients where I filled the advance request, and I give them our beta form, if you want to say that like this, and I explained it how to read that, and then okay, read that, take your time, discuss with your family or with your friends, and then we'll talk later in a few weeks. And then I will answer your question and all that. So.
Perfect.
Just a quick question. So do people go to you directly, Dr. L'Espérance? Is that, or you have to go through your doctor, I guess?
No, normal for advance request.
Yes.
Well, they normally they must have they must ask their doctor or advance, but that's why we're trying to do a lot of information. People should ask a doctor or a CLSC or a nurse to explain that. But no, I had patients because I knew them before.
Okay.
And a lot of many doctors who are in regular practice, because I'm retired of neurosurgical practice, but many doctors who are in practice, general practitioner, have their own patient, and of course the patient asking for that, but it's still not very understood by the doctors, but
It's getting there. It's moving slowly, but yeah.
moving slowly, but it's moving. You cannot, how do you say that in English? You cannot make a flower grow in high
By
rain.
pulling on it.
Putting in it.
Right. Anybody else? Oh, Mr. Cox, you can unmute yourself because we don't hear you.
Oh, I know I cannot do it. Mr. Cox, we don't hear you.
You have to open your microphone.
Open your mic.
Testing, 1, 2, 3.
Oh,
Yes, we hear you.
4, 5, 6. Go ahead.
I'm sorry. No, it's a question that's been answered by your presentation, but it might be interesting. It might interest other people. I was asking if a medical team. Well, first, it's because my wife has been in CHLD with Alzheimer's for 4 years, and I've seen friends and other people in the CHLD. They're there to die. That was my opinion, you know. And I was wondering, I was wondering at first if we could have asked for medical aid and die in anticipation. If a medical team said determined that we have to be placed in a CHSLD, if at that time, instead of going there, could we have the maid? And that was my question, but you've answered it today. There has to be certain.
Well, in fact, a lot of people say that if I have to go in a CHSLD, I want to have maid. Well, we cannot accept this as a reason to have maid. But if you have to go to a CHSLD, it's because you have medical conditions that bring you to have to go there. So you write your advance request if you're apt. You write your advance request. For example, I have a lady who wrote, if I cannot live by myself in my apartment.
You go from one to the other.
So it's a reason, for example. But you must be apt. I'm sorry for your wife, but it's a lot of people will have this now.
The app definition is a bit tricky, isn't it? Like, because I think somebody who started to have Alzheimer, like who's lost their driving license, who cannot take care of their bank accounts, but still living a normal life in terms of eating well, showering, and getting dressed. But is that considered an early stage?
Yes.
This person, I mean, doesn't know what it did the day before. They live like in the moment. So is this considered apt?
Yeah, absolutely. The definition of aptitude, there's criteria, and we're following this. It's also called, one part of it is Nova Scotia criteria, which are accepted almost worldwide. The important thing is not to be able to go to the bank. The important thing is do you understand your disease, whatever the disease is? Do you understand the consequences of the disease? Do you understand what the treatment will do? Do you understand what, if you don't have any treatment, what will happen, etc.? So these are the things we're looking at. A lot of people don't have their driving license, and they have difficulty to live in their apartment because they forgot things, but they're still very apt to decide for themselves. For example, I will ask that people, well, lady, I know that you have Alzheimer. I know that you're in that stage and etc. But we also know that you have here small things that perhaps we will have to take off for surgery. Do you understand? Yes. You want to take that off? Yes, I want, because we have to be sure it's not something bad. So if that person understands, she's apt to decide.
Okay, that's very good. Okay. So I think we're at
I
the
will
end.
I will
Sorry.
just add that if we're not sure of the aptitude, it's not very frequent, really. But if you're not sure, we ask a psychologist or a psychiatrist to evaluate the people. The same thing if we think that the person is depressed. We ask a psychiatrist or psychologist to help us. Yes, Mr. Cox.
Yes, I'd just like to say that I've attended other presentations on MAID, and this is by far the best I've seen so far. Congratulations, Doctor. Thank you very much.
Thank you very much. Merci.
Thank you, Mr. Cox. Yes, thank you. Okay, and you can write that in the evaluation. And also in the evaluation, we'll be asking you if you have any other suggestions of topics that you'd like to hear about. So feel free to write that in the form. Okay, well, thank you very, very much, Dr. L'Espérance. It's been most informative. And thank you for doing that for us today, and in French on Tuesday. Thank you. So everybody, wishing you a great day in the snow. We also have future video conferences coming, so keep informed with the newsletter that we send every month on our Facebook, and also the messages that we send about the events that we have. So looking forward to seeing you perhaps in other video conferences. Thank you very much, everybody. Have a great day.
Very much for your assistance and for your question. Hi, everybody.
Bye-bye.